Hello, my name is Keri Halleck, and I am submitting my final video in PowerPoint for completion from my MPH with emphasis in nutrition. 3 years ago today, I began this journey with Liberty University in an effort to enrich my understanding of what is currently happening in America with the obesity issues that has taken our nation into one of the hardest areas that our country has to overcome, and to be part of the long-term solution. As an educator for the past 11 years, I have witnessed the obesity epidemic in epic proportions. I live in beautiful Athens, Clarke County, Georgia. Like the next slide shows, it truly is a beautiful place to live. However, what this picture hides is that my community is one of the highest in obesity in the state of Georgia and comparatively the nation. As a state, Georgia now has the 18th highest adult obesity rate in the nation, with 30% of its total population considered obese. It is also among the 10 states with prevalence of adult obesity at or above 30%, and an additional 35% of adults are considered overweight. Also, as it relates to children, the prevalence of obesity among 2 to 4-year-olds from low-income families as well as high school students remains high at 13%. However, for 10 to 17-year-olds, the prevalence is much greater at 17%. As the next slide will show, the health consequences and costs associated with obesity, beginning with childhood, are astounding. Obese children are at increased risk for hypertension, diabetes, sleep apnea, asthma, and low self-esteem. This carries into adulthood an increased risk of over 20 major chronic diseases, including cardiovascular disease, gallbladder disease, and even cancer. Obesity has become one of the leading drivers of preventable chronic diseases and healthcare costs in the United States. By the year 2030, combined medical costs associated with treating preventable obesity-related diseases are simulated to increase up to $66 billion per year. This past year, I began to research where I could best apply my knowledge as an educator with the foundations that I have learned from my MPH program classes. A local Athens nonprofit organization called Mercy Health Center was able to perfectly combine these two parts of my life into my internship. On September 10, 2001, Mercy opened with a prayer, and volunteers began to care for the medical, emotional, spiritual, and physical needs of the patients within Athens, Clarke County that are within the lowest socioeconomic percentile within our community. As slide 4 shows Mercy Health Center today, in 2007, Mercy moved to its own facility. They now have full medical clinics scheduled throughout the week during regular hours, as well as Tuesday and Thursday evening hours as well. They also have pharmacy refill clinics on Wednesday mornings as well in the evening hours, and dental clinics are now held every Friday. Just last year, Mercy had over 10,000 patient visits. When I spoke with Grace Johnson, the assistant director at Mercy, about my goals as where I envisioned myself after graduation, she asked if I could be part of Mercy Health Center for my internship over the summer and work with them on a new initiative that they were considering called Healthy Living. Athens, Georgia has limited resources for children and families who struggle with obesity and morbid obesity. Through the development of Healthy Living, families with children ages 5 to 12 who struggle with obesity and morbid obesity will be able to have a multifaceted whole person approach to achieving a healthy lifestyle. Incorporated in this initiative is a combination of a physician, personal trainer, dietitian, and counseling services for the entire family. This is a new approach to working with overweight and obese children and their families in Athens, Georgia. Healthy Living, it was at the very beginning stages, and all of the legwork would need to be completed in order to develop this program. My 3 objectives upon arriving in May are on the next slide. The developing of a community needs assessment. This was to be conducted with 10 families, identifying target area resources and locations that would best serve the lowest uninsured population from the perspective of the participants. 2. Creating healthy living with the Assistant Director of Mercy Center, using policies and programs that were grounded in theory, supported by evidence, and based on input from the community. And the community needs assessment. And 3. Identifying 15 new organizations as potential partners for healthy living and a personal contact for each of these organizations. I began working right away. Within the first 8 weeks, I was able to make 15 new contacts with local organizations around Athens and within the Atlanta area. There was also a wide variety of local physicians, the head director of Athens Farmers Market, hospital personnel from our 2 branches of hospitals here, and local business owners. I met with them in person, and all were very excited about the future of healthy living. My next objective was developing a community health needs assessment. This was developed through guided research and under the supervision by Grace Johnson. This was developed in June, and the surveys allotted to be completed within the first week of July. However, this was the most frustrating and trying time during my internship. We were scheduled to complete the surveys alongside Athens Regional Hospital during their Family Obesity Awareness Days. This was disappointing because only one family that met our criteria showed up. Grace and I had to go back to the drawing board and figure out how to go about the right way in identifying the families and conducting our surveys. This ended up working out in our favor, but put this step in the program design on hold for approximately 4 weeks. One of the contacts that I had made was part of the Athens Housing Authority. As you will see on the next slide, the Athens Housing Authority has a long history in Athens and currently maintains 11 different government housing communities for families in the lowest socioeconomic status. Once we had the final approval from the Director of Residential Support, I was able to have full access to the families within the housing community. This was one of the most influential times for me during my entire internship. I was able to personally go to the families and talk with them at their houses and gain a better understanding of what they are going through and the struggles that they face every day. I was able to work through my entire surveys, and all of the families were very generous with their daily habits and lifestyles. However, because this objective was very difficult to complete within the allotted time, and we had to extend it out an additional 4 weeks, it did not allow us time to complete the design for healthy living. This was frustrating. However, I was able to take away much more valuable information that is being applied to the program than what we would have gained from completing them at the Athens Regional Health Fair like originally planned. There is still much work to be done in the final program design and board approval. This will be completed in the upcoming months using the information from the surveys. I gained valuable information from my internship this summer. I've walked away with a renewed faith in people, in the public health system, and the work that needs to be done. My hope is that the obesity epidemic will be something that I will see a positive change in my community in the near future with healthy living. I made valuable relationships with people in our community and have a future where I can work with these new partners upon the completion of healthy living. I was forced to step out of my comfort zone this summer and fight for a program that I believe should exist. I gained a lot of wisdom in the areas that I need personal growth in and found strength in areas that I didn't know existed in myself. I am thankful for this summer and how I grew in my spiritual walk and where I ended my internship. It was a wonderful experience. Thank you, Liberty University, for your support this summer, and thank you, Mercy Health Center, for allowing me to work with healthy living and the future of Athens-Clarke County.